So actually, before I even start with this last presentation, I do want to take a moment just to thank the faculty for graciously accepting the invitation to come and to our conference and help with this program. And as you can see from the slides, there was a lot of hard work putting into developing the program. So I do want to say thank you to all of you for doing that. And now I want to thank you guys, the audience, because I am overwhelmed with how much interest and engagement and eagerness you guys are showing. So that just is really great to hear. And all the questions that you've put into and helped facilitate some wonderful discussions that we had with the faculty. And so I hope I can take this momentum and we can go through how we can keep you engaged, and hopefully when you leave here today, you're going to ask yourself, how can I stay informed? What are my resources after you leave this conference today? And so here's the majority of the online platforms and websites that do a lot of SMA, research, updates, informations management, and care. I did include Stanford University on here because, as you can see, we've been videotaping the last 2 days. Our goal is to be able to edit these videos and then put them on a platform so that these presentations can be accessible to people after the conference. So if you have colleagues or anyone who wasn't able to come, that would just be great that we can share this information for people who are unable to attend as well. And then I wanted to also make sure to mention that, again, thank you so much for submitting all your questions through the ARS system. We are going to answer them all for you, so don't feel bad that they weren't answered today or yesterday through the microphone, and then we'll post that as well so that you guys can have those answers. So if you still have any burning questions, submit them into the ARS system and we'll make sure we get them answered for you guys. Oh, and so specifically, this last presentation is to really focus in on two resources that we have for the community and educational initiatives that we wanted to inform you about. So the first is stemming from Cure SMA. This is the patient and family organization that really supports patients and families with SMA, and I've done a lot for the research community as well. And so there's an SMA industry collaboration that is a multifaceted partnership that brings together all the pharmaceutical companies and industry, along with Cure SMA and other nonprofit organizations, with the ultimate goal of this collaboration to be able to share information, ideas, and data to further SMA research. So one of the main collaborative aims for this industry collaboration is to have more effectively address a range of scientific, clinical, and regulatory challenges, from bringing the patient voice to the FDA, assessing what unmet needs there still are, approaches to combination therapy, and to try and reduce the diagnostic delay for SMA patients. And so something that came out of this collaboration was the ability to create these clinical trial readiness toolkits. 3 of them have been created so far. One is the basics of SMA and the effective conduct of doing clinical trials in SMA. The second is the best practices for clinical trial coordination in SMA. And the third that I'm going to focus on now is the best practices for physical therapists and clinical evaluators in SMA. And So this was a huge effort and an undertaking. It took a little bit over a year to create, and so you can see that this was done by Kristen Crochelle from Northwestern, myself, as well as Rosangel Cruz, Allison Mazzella, Mary Curry, who's here today, and Elsie Peterson. And so we really wanted to identify the potential gaps in readiness for new clinical evaluators getting ready to engage in clinical trials in SMA. And so we submitted out readiness surveys just to try and gauge, the unmet need of the PT and the evaluator, what kind of resources they need to feel like they could go and assess patients with SMA and feel competent enough to do that. We did follow-up interviews with physical therapists and occupational therapists, and also used the prior experience of our colleagues. And so This toolkit really recommends specific educational materials and resources to help in the training and facilitating PTs to be ready to successfully engage in a clinical trial. So this toolkit has 4 separate sections, but really it's kind of like a multitude of sections that will help you prepare. So section 1 is starting with the role and responsibility of the clinical evaluator in clinical trials, where we do give a background on SMA drugs and pipelines, as well as discussing the role of a physical therapist and the responsibilities when conducting a clinical trial, what's required, whose responsibility is it to go through quality assurance. Section 2 is what steps you may need to take before participating in a trial. So we really start to highlight what are the trainings a clinical evaluator would need to do, what kind of professional development may be required, what's the regulatory essentials that may be needed to participate in a trial, what online modules that you'd have to complete, a review of what study protocol development is like, as well as what to expect in investigator meetings, and then also the need for a collaborative, patient-focused approach to doing clinical trials. Section 3 is our largest section. It's overviewing the evaluation of patients with SMA. So we do give an overview of the evolution of some of the outcome measures like we discussed in today's session. We talk about evaluation in a clinic setting versus evaluation in a research setting, and kind of the role of using all these natural history studies that you learned about yesterday and today, and how that plays a factor when you're doing your assessments. Then we also list out the available motor function outcome measures by phenotype, the tests most commonly used if you're seeing a non-sitter, a sitter, and a walker, as well as pre-symptomatic tests. And Tina showed the figures that were developed for this toolkit to kind of lay out across the disease spectrum what assessments are available. As well as adult assessments as well, looking at pulmonary outcome measures, patient-reported outcome measures, and then important aspects when conducting a research evaluation. And then the last section, section 4, is really considerations related to doing those evaluations. So how does the standards of care play a part, any other supportive care, multidisciplinary care, your role in the context of the care team, safety considerations when doing these assessments, considerations when evaluating chronic adults, and then best practices. Then we also created an extensive appendix section of additional resources with lots of tables of what the regulatory trainings you may need to do, a seminal paper reference list, which is up to date up to 2019, and I know we'll have to update it again in a year. All the external resources we can find online that would help provide additional SMA education and training, as well as a table of all the outcome measures that have been used in SMA and the resources available to look more into those more depth, as well as professional development opportunities, what other meetings you could attend, and continuing education you could do if you are still interested in improving that, as well as getting the Roam Kit supply list if you wanted to create your own Roam Kit at home. And then we also have a page at the end, just a how-to guide on using the toolkit itself. So it actually just launched online last week. An official announcement is going to be made on Monday. But this is how you access it. All 3 toolkits are available for download, but you must complete a survey first so that Cure SMA kind of knows who's interested and who's engaged. So if you go to this website, you can get access to it. And I will say, if Mary's still here, she did a lot of great work making the toolkit, which is a PDF, very user-friendly by embedding hyperlinks in so you could click all through and get exactly what you need. So again, this is originally developed for the clinical trial readiness program, but as it evolved in the last year and we were able to put all of our resources in one place, we recognized that the larger community outside of research and clinical trials would also benefit from these. Now I'm going to hand it over to Jackie to talk about the second initiative on educating therapists.
Thanks, Sally. So Sally's involved in a lot of things because she's involved in Step In as well. So Step In stands for SMA Teaching and Excellence for Physiotherapists, an international network. And it developed, sort of how we got here is we recognized after just that wonderful day in December 2016 when there was the first approved drug for SMA, that there was instantly a greater demand for SMA PT experts around the world, both for outside of the clinical research community and within the clinical research community, because also there were several more trials at that moment and then coming down that had an incredible demand for physical therapists like ourselves to take part in. So we identified this unmet professional need, and that need encompassed both training expertise, resources, and sort of a community and network so that we can engage and learn from each other. So the first step in understanding what that need really looks like was a needs assessment. So we queried PTs around the world working with SMA patients and asked them what other resources would be helpful for SMA and SMA evaluators. And sort of uniformly, everybody said online resources, continuing medical education, listservs, mentoring, apps, communication boards, all that great stuff. At the same time, with the generous support of Biogen, we launched an Excellence in Training pilot program. So here we identified SMA clinical evaluators within the Biogen program and asked them to stay for one extra day. And we invited a colleague of mine who is a PT educator in the Columbia Physical Therapy School to help us learn to be better educators. I feel like I wasn't taught to be a teacher. I can teach families and patients, but really I'm a clinician. I'm not really an educator, and I think generally there's few educators in the PT world. So it was great to have her sort of guide us through how to be a better teacher. And so we did that in 3 regions around the world as a pilot program to see what other training expertise and resources we could put together. And then after that, I think Sally, myself, two colleagues from Biogen, and a colleague, Chris Yoon, sat in a room at Columbia in December and came up with the step-in acronym. And we said that in that meeting, we said the core purpose of Step-In was to develop expertise and shared educational resources for PTs who provide clinical care or research, both for children and adults with SMA. And it's a long-term plan and it's an ambitious goal, but we really want to have a multi-dimensional infrastructure which includes a curriculum and resources and a platform that fosters mentorship, collaboration, and research. I like to think of it as sort of the AARP for PTs. Not that I have any association with AARP, but not yet anyway. But in that vein, something to bring us all together on an international level. So somebody told us that if you start sort of a community organization, you have to have a mission statement. So we Googled what needs to be in a mission statement. And so this is what we came up with: to connect an open, inclusive, collaborative global network of PTs of all levels of SMA experience and training. And here I really want to highlight that we feel very strongly about open, inclusive, and collaborative. And that we have to have values. That's what the internet told me. And so we believe in accessibility and the sharing of knowledge, educational resources, and providing expertise in a professional and respectful environment to nurture physiotherapy connections and partnerships. So with that as the ethos, let's say, of Step-In, this is our initial team. So myself and my colleague, Jean Timberberg, who is does not have a background in neurology or neuromuscular. She's actually an orthopedic physical therapist by training, but she's also an educator and has a prominent role in the APTA, has really been the driving force in all of this. I'm just going along for the ride. and then, our core advisory board and co-founders in Sally, Kristen, and Chris. But here's sort of the initial structure. We're thinking that we want to reach out to PTs, but we also recognize that the SMA community is a stakeholder in this, and that that includes families and patients with SMA, our interprofessional collaborators, and industry, and these are all important stakeholders in what we hope Step In grows into be. For the PTs, we definitely want some of accessible additional resources, but in this lower left corner, the formal education program is something that we really want to build out as well. So, aside from the formal education program, we hope to develop open access resources. This would include educational modules that introduce people to SMA and the SMA assessments and scale overviews. We would hope to have continuing education course videos like the ones that will be generated from this meeting. We have already videos posted from our first meeting at Columbia. Certainly the SMA Clinical Evaluator Toolkit that Sally just spoke about. We thought that we're uniquely positioned to be a repository for all the translated manuals. You might be able to appreciate that there are several sponsors that are doing global trials, and there's numerous versions of translated manuals, all the manuals you saw, and it seems that is inefficient and also leads to some confusion, and so who would be better positioned to be the repository for the translated manuals? That's our hope. We hope to have an online registry that would be sort of like Find a PT that does SMA kind of thing, and certainly a communication forum so that we could have listservs and discussion boards and such. And don't be mistaken, these are all very lofty goals, and this is a 10-year plan, not a one-year plan for sure. More specifically about that online registry, having a database of SMA PTs around the world, like a Find an SMA physiotherapist tool. It also would allow us to, this database or this registry could potentially allow us to track characteristics of SMA PTs in some way and potentially outcomes, but also be a resource for future collaborations. The communication forum that we envision should have interactive capabilities like frequently asked questions. And what about job postings? That's another sort of opportunity to network. To look a little more specifically in the formal education program, because we believe that's one of the most important places to start as well. There's several steps to develop a formal education program. Our goals are to describe the knowledge and optimal skills of an SMA PT at various defined levels of experience. So we just assume we know what is needed to be an SMA PT, but we need to write it down and get buy-in. This is one proposed model where there's not that this is necessarily a linear sort of trajectory. You could certainly novice, intermediate, and expert, but we'd need to define what those levels look like. Some people will go on to be educators or trainers, and some people might be interested in research. To design a curriculum that would ensure achievement of the knowledge and skills. Then we need to know how to test those acquisitions of knowledge and skills. So we can't just give it and assume that it translated to you. We need to be able to evaluate that there is knowledge and skills. So our first step in doing that, no pun intended, our first step in doing that was a meeting that just happened at the end of September. Thanks to the support of Roche, we gathered 13 SMA experts in Copenhagen, and we worked really, really, really hard for 2 days, and this is what we accomplished. We were able first Jean taught us about the various frameworks that can be utilized for defining outcomes for learners. So in order to develop a curriculum, you need to have an outcome. So it's almost like you walk backwards. What do they look like? And then how do you get there? So we did that. We came to consensus. Now that was really impressive, because put 13 of us in a room, we usually don't come to consensus, but we quickly came to consensus on what framework we wanted to utilize. We also were able to define outcomes of learners, so we developed lists of competencies while we were there. What we didn't come to consensus and we ran out of time for was really understanding that the continuum of learning, or this benchmark points, that novice, intermediate, expert. We didn't get to defining that. So if there's somebody that wants to support that meeting, I can talk to you after the course is over. So the next steps. The next step is a Delphi study, which actually we're hoping to launch the first week in January. So if you're interested in receiving an email and participating in this Delphi study, that would be wonderful. So we took all those lists of competencies, and we want to know if we got it right. Do you agree? Do you disagree? Did we miss something? Is there something redundant? So we're going to take what 13 people generated and test it around the world and get feedback from that. And after a few rounds of surveys, we'll eventually then look to developing the curriculum, which I think once we have those competencies and those definitions and that framework, developing the curriculum is probably going to be the easier part, because in large part we do that. We did that here this weekend. We do that all the time. The challenge is how do we assess the achievement of or how effective our curriculum was, and we know that some knowledge could just be web-based, sort of the core knowledge, the basic stuff, and then we could have some online assessments, but really the ideal way of learning, of evaluating knowledge translation, is in a workplace assessment. So that's when you have, your student or your new colleague, where you teach them the Hammersmith, and then you're in the room and you watch them do it, and you watch them interact with patients. So really, we value workplace assessments, and honestly, from what I've learned, that is the medical education is moving into that direction, for physicians, for physical therapists in Canada. Maybe some of the Canadian PTs could help us on that. But there's definitely a transition, not just to, here's what you need to know and just assume you know it or take a test, rather workplace assessment that's not time dependent. And then we need to launch a pilot program. So we're thinking, how great would it be to then, once we develop the curriculum, to have a handful of people who want to be the educators and trainers and give them that curriculum, and a handful of new people that want to learn about SMA, and then have a workshop and see how it rolls out. So with that, I'll end. We're very, this first step in, we've gotten a lot of support from industry and from our colleagues, and so we hope to move forward with this as well. So, thanks. Any questions?
Okay, great, Jackie and Sally. This is really awesome. It's really would be really beneficial for the community. And from the questions, there are more comments that everyone's really excited about it and really want to be involved. So there's a few specific comments about that. Then there's other questions that are related in general to assessments that's been asked in this session that maybe can be asked in combination with the general sessions altogether. But before that, I do want to thank Sally for really putting this together and coordinating and doing all this hard work to really put a great 2-day session together. We can't thank you enough, and I'm serious about getting the band together. You really have contributed to one of the initial steps to really helping the community, so thank you. Okay, that being said, with all the assessments described today, how do you choose which ones to do when limited by fatigue? How do you prioritize? How might you do it with OT and PT doing different assessments? And are there any sample documentation?
Oy vey.
I know.
Well, one thing we tried to do when developing Toolkit, Kristen, Crochelle, and myself, was like an order of prioritization. So there is a list in there that we've laid out by functional status of the patient. What if you only have time to do one assessment, what's the key one to do? We've listed it out that way. So hopefully that can be informative to you. And again, depending on the patient's status, their fatigability, exactly what was mentioned, and how many assessments you can actually get done. And also what the goal is for doing the assessments as well.
Okay, great. And the other question is about the natural history. So the question is, I'm not a research person, so I'm not sure what it means when you guys say natural history. Please explain.
Change over time. So the how they change and function over time. So then without intervention, I guess, would be the way I would define natural history. So but now, so natural history up until now was without a disease modifying therapy. So that we know the natural history of motor function. We knew the natural history of motor function without treatment for several years, and there's lots of, and we use the Hammersmith to evaluate that. Now we need a new natural history because we have disease-modifying therapies. So what we knew to expect is changing.
Okay, great. And I think most of the others are comments and the people who are very interested in being part of both the programs. And so we will definitely take note of that and be in contact with you. Either Sally or Jackie will be in contact with you about participation in both of these terrific programs. So.
I did want to add one thing I was remiss saying when I was up here is for those Californians and even non-Californians, but the therapists at Stanford, Tina, Richard, myself, I realized we did not give you guys our email addresses anywhere, but we would love to be a resource to you, and so we do still have business cards at the research table, so if we can be of service or help provide guidance, please feel free to reach out to us, and we'd be happy to help in any way.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.